if you're dealing with a tense pelvic floor, what this means is that you might be experiencing pain in sitting. You might have a lot of pressure in your hips and kind of this intra-abdominal pressure that's really low. You might be having pain when you're having intimate time with your significant other. Sometimes there's bigger things going on, but a lot of the times your pelvic floor muscles, it's a set of very important muscles. We just don't treat it like that. May just be tense. And so these are some exercises that can really help you if you're feeling tense. So before you're going to use your pelvic floor, might be a good idea to go through these. First, diaphragmatic breathing. You're going to lay back. I like to bend my knees. You can do whatever you need to do. You're going to take your hands and you're going to put them on your rib cage. Like almost grab your rib cage. Close your eyes, relax your body as much as you can. And then as you breathe in, I want your diaphragm to lift with your breath. Okay, ready? Press the air out. You're going to feel your belly lift. You're going to feel your ribs expand and then feel your body just kind of melt. And then try breathing in through your mouth. And when you exhale, connect to the pelvic floor, these lower muscles all around the hips. So I want you to take anywhere from 10 to 20 really big, beautiful diaphragm breaths, relaxing into your lower abdominals, relaxing into your pelvic floor. It's the first thing you're going to do. And then you're going to either bend your knees or keep your legs long if you can. You're going to alternate drawing your knee into your chest. So you're going to just do a couple singles. One. Now, as you're doing this, relax your upper body, relax your shoulders, relax your head on the ground. And you might be more comfy doing this, that's fine. And then I want you to do a few where you kind of move around. Keeping your tailbone on the floor, feeling this through the front of the hips. And then that just, all those connection points between our legs and our hips and our torso. Continuing to do that deep, beautiful diaphragm breathing as you move. So just doing a couple switching, see what feels good. Again, if you need to bend your knee, totally cool. Visualizing your lower body relaxing. Visualizing your pelvic floor muscles relaxing. And then just do a couple switches. Kind of see how it feels, maybe a little looser. Maybe just a little bit less tight, right? Don't breathe shallowly, breathe with intention. So that's move 2, and then move 3, you're gonna come into supine frog. So keeping your spine stay relaxed and calm, keeping your spine and your tailbone connected to the floor, and then just flex your feet. I've got my hands on my shins. You can put them on your knees if you want to. And then just draw your legs open. Breathe between your hips and your thighs, deep into your pubic bone, your pelvis. Let gravity and then this gentle pull with your arms just try to relax you. And if you've got a ton of tightness and you're kind of used to experiencing pain in the pelvic floor, this might be hard and you might need to do this a lot of times before you kind of trust the process and feel the difference. You can kind of move side to side. Be patient with yourself, but also be persistent. These are a set of muscles. They can be opened, they can be strengthened, and they can be relaxed. Relax your belly. So you can continue between those exercises, between the breathing, between the knee pulls to the chest and holds to the chest, and then your supine frog with the legs open and just relaxed. And then maybe you come down into butterfly pose as well to kind of end the little series. Just maintaining this open, relaxed posture. You can have your hands on your belly or your hands on opposite elbows just over your head and just breathe. Remember, breath, intention, and persistence. Continue to do these exercises. Continue to work on strengthening and opening your pelvic floor.